Hey bro,
What's up?
when are we going to the concert?
8 o'clock, I told you already.
8? Okay.
Yeah.
Okay. Hey, when are we leaving for the concert?
Oh, we're leaving at 8 o'clock.
8?
Yeah.
Okay. Hey, so when are we going to the concert?
Are you stupid, bro? We just got back from going to the concert.
Oh, okay.
Are we serious right now? Alright. I think something's going on. I gotta take his ass to the doctor.
One eternity later.
Hey, listen, man. I hear they're gonna come back with your MRI test anytime soon, but I'm gonna go get myself a coffee. I'm tired.
Oh my gosh, bro. I thought that guy was never gonna leave. You should hear how he snores. Who are you? Are you my doctor?
You could say I have a PhD.
Oh, I'm so glad you have a PhD. So, what do I have?
I don't know.
Well, it's because my mind's been really foggy, and I've been forgetting things.
It is that damn phone.
Oh, okay then. How can I treat this?
I got just the thing for you, my friend. I do have so much to tell you. Been looking for a relationship recently. Who needs a relationship when you got these gas prices? God, $4.50 a gallon.
Hey guys, got the results back from the MRI and we're suspecting Alzheimer's.
Alzheimer's? This man does not have Alzheimer's.
Must be one of them anti-vaxxers. Who are you?
You just don't recognize me?
Follow finger, follow finger.
No. Think, Mike, think. You seriously not?
Now who are you, bro? Dr. Evil? Why do you look different?
Ever heard of black though? I've been bone smashing. None of that matters. As this guy doesn't have Alzheimer's. 30 ounces, ketamine, 3 times a day. Did wonders with my last 2 patients.
How about you try this bone smashing? Get out! Fourth time I've had to deal with that guy. Anyways, before we got interrupted, Mr. Fausto, was looking over your MRI. We suspect you have Alzheimer's.
Alzheimer's? Who did I get that from?
Well, Alzheimer's can't be transmitted to anyone. If you have a concerning rash, that's something else.
Oh, okay then. Well, how do I treat it?
I'm glad you asked. Let me tell a story. What is Alzheimer's? Well, Alzheimer's is a neurodegenerative brain disease that directly targets your brain. It is caused by neuronal cell death and causes cognitive decline over time. Alzheimer's is also known as the leading cause of dementia. Alright, let's go a little bit into the genetic and environmental risk factors that help manifest Alzheimer's. In the genetic side, we have AB precursor proteins because it was discovered that the toxic buildup of these causes a cascade of events that lead to neuronal death and disease. On the environmental side, there are things like air pollution, inhaling toxic metals like lead and copper, as well as old age, which is the main one because after age 65 it increases 30%, and over the age of 85 it increases up to 30% of developing Alzheimer's. If you have family history, it also increases the chances of you developing Alzheimer's. Let's take a look at the 2 main ways that Alzheimer's affects the brain, starting with beta amyloid plaques. Here we see the cell membrane of a neuron, and in the middle there is a APP protein or amyloid precursor protein. There is a Y secretase that cuts this protein with the help of the alpha secretase, and together they cut at the right spot to make this protein soluble. Once it's been used, it can be replaced and it goes away perfectly. But sometimes B secretase comes in, improperly cuts this protein, and makes that base insoluble. And if we take a look at the neuron, if enough of them get cut incorrectly, there will be a beta amyloid plaque, and that prevents synapses between both neurons and overall will decrease your cognitive function over time. The second way are the tau tangles. These are twisted fibers that are inside the neuron that disrupt the transportation of nutrients, which then causes cell death inside the neurons and causes cognitive decline. Let's take a look at how this happens. First of all, we have your microtubule, which is the structure of the cell, and in there, the little red dots are the tau proteins. So these keep structure, prevent this microtubule from breaking down, and it maintains everything as it should be. But sometimes these tau proteins can be phosphorylated, and that causes them to break away from the microtubule and form plaques outside of it, which in turn breaks down the integrity of the microtubule, which causes the lack of transportation to the nutrients and leads to cell death inside of the neuron. The accumulation of the tau tangles and the amyloid plaques forming eventually leads to damaging of the neuron transmitters or the loss of these neurotransmitters. This also happens due to a significant loss of the ACH, which is in turn due to the degeneration of cholinergic neurons. This causes a weakened memory, cognitive decline, and also leads to neuroinflammation, where the microalgia get activated and they release inflammatory mediators, which in turn worsens the neuronal injury. All of this accumulates and with time leads to brain atrophy, where there is a progressive loss of neurons and synapses in your brain, which makes you lose cognitive function, you operate slower, and you lose a lot of your memory. Next up, we have the signs and symptoms of Alzheimer's. I've briefly touched up on, one of the major ones, cognitive function decline, memory loss, but the truth is that they can be divided into three major categories. The ones that happen in the early stage, the ones in the progressive stage, and once it's severe Alzheimer's. In the early stage, we have short-term memory loss, which could mean that they sometimes forget conversations they've already had or what they ate for breakfast. The other is misplacing items. Maybe they lost their keys. They also get lost in familiar places, like in their house or let's say work site. In the progressive tier, we have impaired judgment, confusion of time, date, and place, and depression. In the severe case, this is when they start losing memory of their loved ones. They forget who they are, that they could be their son, their wife, or their daughter, and they also lose the ability to communicate with others, as well as difficulty swallowing, which could make them suffocate.
But doctor, are there a visual way to see these symptoms?
Well, of course, my dear patient. Let's take a look at some visual representations of these symptoms. First, we have memory loss.
Damn.
Impaired judgment and decision making.
I should call her.
Depression. Mood swings and personality changes.
So that, my friend, is how you develop Alzheimer's.
Okay, cool. So when will I be cured?
Let's get into that.
Can you prevent Alzheimer's? The short answer is no, you cannot prevent Alzheimer's. However, the stuff that is available slow down your cognitive decline, like managing your blood pressure, as well as increased physical activity, cognitive training for memory, Okay, there might not be a sure way to prevent Alzheimer's, but is there a specific treatment? Answer is no, there's no specific treatment for Alzheimer's either. All the treatments that are available improve quality of life and slow down the decline that is caused by Alzheimer's. There are a couple medications that help aid in the symptoms but won't get rid of them, like anti-amyloid immunotherapies like donanemab, which can target and remove amyloid plaques in the brain to slow down decline. And there is cholinesterase inhibitors, which they treat memory symptoms because they prevent the breakdown of acetylcholine. It is very important to remember that these medications, again, don't cure you from Alzheimer's, and most of the time they are only effective in the early stages as they slow down the cognitive decline caused by Alzheimer's. For the next topic we have is risks and concerns. Risks and concerns include the increased falls or injuries like broken bones, hemorrhage, sometimes strokes could lead to these injuries, wandering and getting lost, and the third one is difficulty swallowing, followed by malnutrition.
Alright, you guys, it's been about a week since you guys left the hospital. How's it been?
Honestly, it's been kind of rough though. I'm trying to get through it.
Really, what's been going on?
Oh, he's been forgetting where he's at. I have to wipe his ass. Everything.
Huh? Worse than I thought. Here, how about I give you some medical advice on how to make it easier for you and for him to live together?
Yeah, yes, please.
Alright, so first of all, you're going to need to have patience with him. Chances are it's declining and it's just going to be worse and worse. So have patience with him, reassure him whenever he needs to, and avoid arguing and getting frustrated with him, alright?
Alright.
Another thing that you can say is that if he ever needs your help, just let him know you're here to help out and not, antagonize him. Another thing you can do is redirect his attention. How will you do that? By surrounding them or like stuff that they like to listen to, taking a walk, or you could read a book. And you could also make sure that their home is surrounded by stuff that they love, pictures of loved ones. You could do stuff. Maybe he's into headphones, so make sure he's got headphones on 24/7. And just keep a routine that's easy to follow. 9 a.m. breakfast, 10 p.m. shower, stuff that you can be consistent with every day. And this is important. Does he wander?
Yes, sometimes.
Alright, if you ever catch him out on the street, make sure he has an ID and make sure he has a medical bracelet in case he slips out again. People can find him and return him to his home. Sound good?
Yeah.
Wonderful. Pleasure working with you guys.
Thanks so much, Dr. Mike.